Welcome, everyone. Thank you for joining us this morning. I'm Kate Kite, Continuing Education Coordinator with Illinois Heartland Library System. And this morning we have Cheri Burcham, who's a Family Life Extension Educator with the University of Illinois Extension Office. And Cheri's going to be presenting to us an overview of mental health first aid. So thank you for joining us this morning, Cheri. I'm going to go ahead and turn it over to you.
Okay, thank you very much, Karen and Kate, and thank you for having me. And so I was asked to do kind of a one-on-one, kind of a teaser training for you this morning, just to give you an idea about what mental health first aid really is. You know, what is it? Why is it important? Why should I take it? Those types of questions answered. And so I know she already introduced me there. I don't have my camera on today. I told her I wasn't feeling super great. So you'll just have to see me look like that today. But I have been in extension for 26 years. And mental health first aid is just one of the things that, one of the programs that I do as an educator for them. So I would like to start off by asking, I'm going to give you a couple scenarios, okay? So say this happens to you, all right? And probably Karen and Kate, you're kind of on the, it's you. You're going to have to answer these. So, but a colleague seems to have lost all pride in his appearance and enthusiasm for life. His speech is sluggish, he's sad all the time, and he'd recently given away several favorite office possessions. So in that situation, do you think that you would end the call quickly? This is not your problem. People who threaten suicide rarely go through it. Your ex, they can take care of themselves. You're no longer together. Ask if they have any plans. Okay, hold on a second. Let me look here. Okay, I want to make sure I have that right. I'm not sure I do. Hold on. Next calls. Yeah, so actually, let's switch that. Sorry. Let's go back. You're at home watching a favorite movie when your ex calls. They sound real upset and talking about wanting to kill him or herself. Okay. And we're going to go back to this. You're going to end the call quickly. This is not your problem. People who threaten suicide rarely go through with it. Your ex can take care of him or herself, and you are no longer together. Or you're going to ask your ex if they have plans or have they made any prior suicide attempts, and consider if she or he has the resources to attempt suicide now. Discuss ways that they can stay safe, such as calling a suicide hotline, a mental health crisis team, or 911. Or would you ask how she or he intends to kill him or herself? If your ex doesn't have a plan, they probably are not serious. And so you can go back to your movie without worrying. So if you want to put in the chat, or it's since there's only 3 of us now, hi Angel, if you want to put what you think you would do, 1, 2, or 3. So Karen says you probably do 2. Okay. Okay, so I kind of started you off with an easier one, right? Actually, this is, so number 2, exactly. You definitely would ask them if they have a plan, okay? And if they've made any attempts. You definitely want to ask them, and Angel, we have like a mix up. So like the actual scenario, good grief, the scenario is up here. And so I mixed them around for some reason. They do say that they want to kill him or herself. So there's really no reason to ask them, are you thinking of killing yourself? Because that is something that we tell people that do if in certain circumstances, but that's obvious. So yes, you would probably want to go ahead and do number 2. Very good. Now we'll go backward. Okay, so now we have a colleague that seems to have lost all pride in his appearance and enthusiasm. His speech is sluggish, he's sad all the time, and he'd recently given away several favorite office possessions. Would you ask if there's anything he'd like to talk about and try to find out if he seems depressed or has any thoughts about ending his life? Would you keep the conversation light, avoiding any discussion of suicide or death? Because he's upset enough already, and you wouldn't want to put the idea in his head. Or take him out for a good drink and send him home in a cab. Alcohol is a stimulant and can help someone snap out of a funk. What do you think for that one? 1, 2, or 3? And Angel already's got 1 on there. And I think you all know that that would be, yes, 1. So sorry for the mix up on that. I was probably trying to multitask. And so anyway, that is absolutely right. So we, in mental health first aid, we really do address some very real life scenarios that would happen to you, whether personally or professionally, anywhere you are in life. So this infographic, this handout here, you'll be getting this at the end of the session. So don't worry about taking a screenshot or anything like that. I'll send that to you. But I want to mention I became an instructor for mental health first aid in 2020. Yeah, right in the middle of COVID, I did the virtual training, and it was part of a farm stress grant that was awarded to the U of I in that same year. And I'm going to talk about the grant in a moment. I want to mention it, but one of the objectives of this grant was to train extension educators to provide mental health first aid trainings, specifically targeting farmers, ag producers, and workers, and those living in rural communities. So those living in rural communities, that can really cover quite a lot of ground. But we also are totally able to do audiences that don't follow any of those criteria. It's just that they don't fall under the grant, so they may not be like free of charge. We have to charge them. So mental health first aid was developed in the year 2000 in Australia, and it was brought to the States in 2008. And it does teach participants how to identify, understand, and respond to signs of mental health and substance use challenges among adults. Okay, so U of I Extension currently has 10 educators in the state that are trained instructors for mental health first aid. Now, there is a difference. Some of them are trained in the adult mental health first aid, which is what I am. There is an adult version, which basically we're teaching adults to work with adults. Okay. Then there's the youth version, which is a little misleading. It's not teaching youth, it's teaching adults that work with youth specifically, like school teachers and people like that. There is a teen version as well that does work directly with the youth. We just started looking into it. I believe we might have 1 person in the state that's trained. And we also have a Spanish version as well. And we have someone that can deliver that in Spanish too. So the course can be taken virtually, okay? And it also can be taken in person. Either way, it lasts 6 hours, well, about 5.5, along with 2 hours of pre-work. So we always have 2 hours online pre-work that you have to complete before you can actually attend the day-long training. Okay. And so it can look differently. It can be all of it virtual, where you do the 2 hours online and then you do the rest of the time, the day of training virtually online, or you can do the 2 hours online and you can do the rest of it in person. Okay, which is the trainings that are coming up that Kate set up. Those are set up for in person, and that's called a blended version. So you're doing part of it online, part of it in person, so it's blended. There also is an completely in-person one that I think I might have done it once, and you don't have the pre-work on beforehand. You do the whole day. It's 8 hours. The whole thing is all in one day in person. It's a really long time, and it's just super nice to have it broken up and do the online pre-work before. That's always my recommendation. But those are options. Now, about 1 in 5 people in the US live with a mental health challenge, but those who do work in agriculture can be even more vulnerable due to the high stress they experience, like, the economic uncertainties, the changes in commodity prices, weather issues, skyrocketing prices on fuel and supplies. So that was why, this grant was designed to really target them, because not only is their occupation dangerous at times, but it is very highly stressful. But the mental health first aid focuses on the action plan. And the action plan, and you might be able to see it on the screen in the little corner there on the right side. And again, you'll get this. But the action plan is you're assessing for risk, you're listening non-judgmentally, you're giving reassurance and information, you're encouraging appropriate professional help, and you're encouraging self-help and other support, or it's called algae. Okay. And most of this is the training surrounds that 5-step plan and all the different areas that you might be in, whether it's early in a crisis or mid-crisis or a crisis itself. We use all of these tools. Let's see here. Okay. So one little bit I feel like I have to mention this, okay, for sure. The farm stress, I always call it farm stress grant because it's so much easier, because you can see up at the top there, North Central Farm and Ranch Stress Assistance Center is a lot there. I always forget how to say all that. But our training originated from this grant, and the grant is provided by the USDA and NIFA, which is the National Institute of Food and Agriculture. This grant created the North Central Farm and Ranch Stress Assistance Center, which is those 12 states in the center of the slide. We are one of those. Also 15 partners. We collaborate to create and expand stress management and mental health resources and services for ag producers and stakeholders in the North Central region. And not only are we teaching mental health first aid as part of that, but we also do have a website, which is basically farmstress.org. Very easy. www.farmstress.org. We have helplines, and we actually now have vouchers for some that maybe they need to get therapy and assistance, but they don't have the income for that. And so we have vouchers that can allow them to go for up to like 3 free visits for mental health sessions. So there's many different pieces and parts to that. So again, what do you do as a mental health first aider? So you've taken the class. What are you doing? And it's like CPR. We call this mental health first aid. It's like first aid. It's like CPR. You give until appropriate treatment and support are received. So sometimes you're just temporarily helping until they find what they need. Secondly, help is offered to a person who's developing a mental health challenge. And I'll show you a little chart in a second about where we kind of come in as far as the spectrum of the mental health challenge. And then third, we are definitely not a substitute for counseling, medical care, peer support, or other professional development. We are not therapists. When you graduate from this class, you don't have a certificate that says that you can deliver therapy. Basically, you're helping people through a difficult time and trying to connect them to resources with professionals. Okay? And this chart, this early intervention here in the middle, that's kind of where we come in. Okay, so we're not really about prevention. We're not doing flyers and trying to help people with preventing mental health challenges, and we're not treating them, right? We're not providing the treatment. We're kind of in the middle there, where we are watching people for signs and symptoms of distress. And when we see those signs and symptoms of distress, then we know how to talk with them because we teach you that in the class. We teach you actual verbiage of, what to say to somebody, because I know personally that can be the hardest thing is, well, what do I say? How do I ask that? I'm not good with that. Well, we give you the tools to do that. And then you're able to approach them, and then you're able to connect them to the right treatment. And we give you resources as well for that. So that's kind of where you land in whenever you're helping with their treatment. Okay. So in the 8-hour course, participants learn several types of mental health challenges and disorders. You learn the risk factors, you learn the symptoms, the warning signs, and what people usually get for treatment on those. And then you'll spend a great deal of time learning about the 5-step action plan, which I mentioned, which is algae, and how it will help whether someone is in the early stages of need or if they are in full out crisis. And then again, we share lots of resources. And I'm actually going to give you today a page of national resources that are available to those in need. But in the class, we encourage you to come up with your own list of local resources as well, so that you're prepared to connect somebody with those. So we have lots of evaluation out there that shows that this program works. Okay, and we are included on SAMHSA, which is the Substance Abuse and Mental Health Services Administration. We are on their National Registry of Evidence-Based Programs and Practices. And beside that, we know that mental health aid works because every day people will send in quotes like the one on the board here and tell about the skills that they have learned to help a person in need. So, and I just know from the short time I've been doing it from 2020 to today, I've done several programs over the years, and always good feedback. And people are just greatly appreciative to be prepared in case something would happen. Hopefully nothing ever happens and you don't ever have to use any of these things, just like CPR, just like first aid, just like any of that, but you're prepared for it. Okay. So Kate has been setting up these sessions for mental health first aid. We had a couple last year, and I thought that they went really well. And the ones that are coming up this year, we have these are both blended courses. So you would be doing the 2-hour pre-work online prior to the class, and then you would attend the class in person. And we have April 18th and May 12th as the dates. We have Centralia as one of the locations and Marion as the other. The times are just a little different. One of them starts at 9 and one starts at 9:30. So then we adjusted the end accordingly. And those include an hour lunch and about a half an hour of breaks, because you need those, right? That's a long time to be together. And it's very interactive, though. We have a very interactive curriculum. So it's not like just you sitting there listening to me lecture, or we always have two leaders as well, two facilitators. So we kind of switch off and on when we do lecture. But we have you get into groups and do some thinking, just like those scenarios that we did at the beginning. We have little quizzes after each section to kind of see how um, you know, absorbed some of that information and kind of review those before you move on to another. We have great videos. I can't say enough good things about the videos that are included in this curriculum, because they show some real life situations. I mean, they're actually actors that are doing them, but they're they're portraying real life situations that can happen, from someone that is just beginning to have an issue to someone that is just full out in a crisis and what to do. So it's great to kind of watch that and see and learn. So if you are interested, this time around, I was able to convince the Farm Stress Grant that this falls underneath that grant. So there is no cost for this class. And normally, I can't remember, Kate, what we charged last time, but I was thinking around $30 or something like that, um, which is still isn't too bad. But I know other places will charge more. But it will be no cost this time. And again, being in person gives you just more of that personal touch, and some people prefer that because you're more hands-on than virtual. So if you are interested in, I know Kate's been putting some things over there in the chat, the links there. If you would like to attend either one of these sessions, please sign up with Kate. I think the April 18th deadline might be next week. So you want to make sure you get in on that. If you're thinking of the April 18th one, we have to allow a lot of time when we do our deadlines, because we give you, once you sign up, we give you the time to do the, you register and then you do the pre-work. And we want to give you time to do all that. So, so that's why there's so much time between the deadline and the actual class. So those are coming up, and then again, I'm going to take a moment, since I don't multitask very well. Actually, after I take this slide down, I will put in the chat. So stay on, and I say welcome, Caressa, and Angel. Uh, all of you stay on, and I will put in 3 different files in the chat box that you can download, PDF files. And one of them is this mental health first aid resources, and it's a 2-pager. There's another page there with all of the different numbers to call, or web pages to refer to. And then we developed this 1-page sheet that tells you basically what I told you in this session, but kind of in a condensed version there about it. And then the statistics flyer that I showed you earlier, I'll send that to you as well. So with that, that is what I have for you. Kate, do you have anything to add or anything to ask, or anyone else have any questions? You can just open your mic if you'd like, because there's not many of us.
I just wanted to say thank you, Cheri. And I did put the 2 links for the Centralia and the Marion to sign up in our L2 platform for those. And whenever we offered it back in December, there was a fee of $20, which subsidized, which
Mhm.
it's a cost recovery. So whenever we do have to pass on some cost to our members, it is on a cost recovery where IHLS still subsidizes part of that fee. But we were very excited that with that grant, we're able to offer these 2 free of charge.
Yeah, that just, I think it makes it so much easier and cleaner, and we don't have to worry about all of that. And it's just nice because it's a service, and we don't want, that cost to ever get in the way of someone getting the information that they could really use.
And I can say, as someone who has been through the mental health first aid training at my previous library, that was a staff day for all of us. It was very worthwhile training. Um, and I really like that we're able to offer these in person. I think that that makes it a little bit more of a safer space personally than offering them online. But I do like that we have the online option, especially with Illinois being so large and rural.
Yes, you are right. And I got those in the chat if you can see them. You can download
Yes.
those, and I can send those still to you, Kate, so you'll have your own versions unless you download them and you've got them.
Excellent. Well, thank you, Cheri. And with that, I'm going to go ahead and stop the recording. And oh, I guess I should say that everybody that registered will get a copy of this, or will get the link to this presentation and these resources as well.